Hi, Dr. Frega here with Ideal Health and Wellness. And I just got back from an autoimmune conference this past weekend, and it was a great conference. We see a lot of autoimmune disease in our practice here, so I was pretty excited to go. I always enjoy going to these and finding out the newest research and what's going on in the field. So this past weekend we talked a lot about immunology, which in that field they are making huge strides, and it's constantly changing. So they're starting to identify different immunotriggers and also effective treatments for them. So again, pretty exciting in terms of what I can bring back into practice as well too. So this week we're going to be dropping some videos on just different stuff that we learned at the conference and how we're going to be incorporating them into the practice. So I'm going to talk today about PANDAS. And for those of you who do not know what PANDAS is, and I'm not talking about the animal, what that stands for is a pediatric autoimmune neuropsychiatric disorder associated with strep. Now, they're starting in the science to really try and rename that because maybe initially where we were seeing it correlated with patients that had strep infections, we're actually seeing that a variety of different infections can cause that, not just strep. So we're trying, what they're doing in the field is trying to call it more of an autoimmune encephalitis. So I wanted to talk about this because we see this a lot in practice, and unfortunately it's not a well-known diagnosis out there. So what's happening, these kids presenting with this, they're being misdiagnosed and being categorized in these behavioral issues, again, being treated for anxiety, depression, again, ADHD, and what happens is that those medications may be managing some of the symptoms, but, and parents will attest to this, those kids really aren't getting better, and again, quality of life just is not great. So a kid with PANDAS, again, it doesn't have to be a strep infection. We've seen it with influenza, Lyme, other viral infections, bacteria. So what happens is that we're going to see an acute onset of this in children, okay? So what you're going to see is potentially OCD-like tendencies, more ADHD, anxiety, depression. Your child could start bedwetting. Another telltale sign is dysgraphia, which is they might have had good handwriting or at least legible handwriting, and now they're starting to write where it's barely legible. These kids can be irritable, their sleep can be disturbed. We could have sensory and motor deficiencies as well too. So previously, again, I think just because this was, again, practitioners aren't really aware of it, and there's nothing really to test for it until now. And again, being at this conference, we learned about specific testing that can be done to evaluate for antibodies that are attacking the brain. So we can actually test to see if they're having an autoimmune reaction, and then treat the child as well too. So whenever we talk autoimmune, again, going right to the gut, being able to identify what those triggers are and that are causing these antibodies to elevate as well too, are really important. So again, these kids, a lot of times these parents come in and again, they kind of feel helpless because they haven't been able to be helped, and their kids are suffering. They're suffering at home and they just don't know what to do anymore. Again, we can effectively test and treat these children to help, again, with parents' overall quality of life and hopefully get this to go into remission. So, in my practice, strep is one of those things. If I have a kid coming in with strep, I do refer out for antibiotics. As a naturopath functional medicine practitioner, I definitely believe in limiting the use of antibiotics, but there's a time and place. Whenever you have an infection like this, it's important to be able to identify it as well as treat it as soon as possible, because that longer that infection goes, the more likely kids are going to develop an autoimmune reaction to it. The other thing too is that you can get endocarditis, again, that affects the heart in children, and that's not something that I want to mess around with. So at our clinic, it's great. We have an integrative clinic. We have a family practice practitioner here that if we do have that positive reading, I can get them over to her and she can prescribe the antibiotic. But what we're also doing here is supporting that child's gut and immune system with things like probiotics and other herbs and natural treatments to help mitigate any sort of negative effects from the antibiotic on the immune system, as well as promote that immune health overall. So again, hopefully this gave you some education about PANDAS and offer some hope for some kids and their families as well for treatment options.